Welcome to Just Picture It. I'm your host, Fung. We'll be looking at how people in California are getting involved with improving the health and resiliency in our local communities. Our guest is Jill Littlefield. She's Senior Associate at ICF International. Jill has a master's degree in organization development, and she is the coordinator for the Western region of the Medical Reserve Corps. Jill has 13 years' experience in emergency preparedness and development. In today's show, we'll find out more about the work of the Medical Reserve Corps and talk about the units in California and what they're doing in our local communities. We'll also talk about how the California Health Initiative is forming up as a medical reserve unit here in the Silicon Valley. Welcome, Jill.
Oh, thank you.
Tell us about the Medical Reserve Corps. How did it get started?
Well, the Medical Reserve Corps got started in 2001 after the attacks on September 11th. What we found was that we thought that there was going to be a large-scale disaster with many wounded, and what happened was everybody descended on the locations to assist. But medical professionals are licensed within their own states. And so what was found was that we really needed to look at that from a federal perspective as to maybe we need to organize volunteers in times of disasters such as that. And so in the State of the Union address, you put in for the Freedom Corps, and the Medical Reserve Corps was developed out of that. It was handed over to the Surgeon General's office, and we started with a pilot project of 15 units, and now we have 990 units across the nation.
Wow, that's a lot. That's very fast growth in really quite a short time span. Mm-hmm. What are the objectives of the Medical Reserve Corps now? I mean, it was a response to 9/11, but now you're working with local communities. How does that work?
Well, we allow, out of the Surgeon General's office, we have the Division of Civilian Volunteers Medical Reserve Corps. And what we are is a clearinghouse for information and project sharing and initiatives that local communities can undertake. But we are not a top-down organization. We are a bottom-up. Communities get to decide what kind of Medical Reserve Corps they need based on the gaps of that city, county, or even at the statewide level. So many of our Medical Reserve Corps units do train and organize for disasters, but we also have a very large component of public health initiatives that the MRC unit volunteers can do throughout the year.
So that sounds like an evolution of the role of the Medical Reserve Corps. At first, responding to emergencies and disasters, and now looking at public health and what we can do better. This is a great move. Yeah. Everybody's really concerned about health.
Well, we've always been concerned about health because we've been in the Surgeon General's office. And so we've actually had that benefit of really working with the Surgeon General's priorities throughout all of the years of the Medical Reserve Corps. And so now, as the winds of change have happened and public health and initiatives are the more visible, we are right there at the cusp and ready to welcome more Medical Reserve Corps units to come in and do public health initiatives for their communities.
So how do local communities participate in the Medical Reserve Corps, and how do they benefit within the local community from setting up a unit?
Well, here in California we have 31 units, and we are supported at the state level by the Emergency Medical Service Authority. And so there's a state coordinator there also who helps to coordinate the Medical Reserve Corps within the state. And each community really identifies if they have a need for a Medical Reserve Corps cadre of volunteers. Because really when you're looking at volunteers, they're donating their time. So it's not like a regular asset where you can just say that we have this many volunteers. It's really based on what that community needs and what kind of partnerships and resiliency you can build within the community to have volunteers work for the community.
So can you tell us about perhaps a city or a municipality that has actually formed a Medical Reserve Corps and what's happened there?
Oh, we have a lot of Medical Reserve Corps in California. Here in the Bay Area, we actually have one here in this county, and they have been doing great work in disaster preparedness and training at the county level. We have also had smaller units here in working with doing flu vaccination clinics. We're very big on flu vaccination because it is part of community resiliency. We want people to be empowered upon themselves to take care of themselves and their families first, and then to be able to give back to the communities. And so we are huge here in this county on flu vaccination clinics over the past couple of years.
What about earthquakes? That's always a concern here in California. Is there any preparation for earthquakes that people are doing?
Oh, we always prepare for earthquakes.
Yeah.
We prepare for earthquakes every year. There is an annual exercise held by the state, and all of the Medical Reserve Corps units within the state of California participate, and they participate in different levels. Some will just call out to all of their volunteers and find out if this was an emergency, would you be able to respond? But some also train. How do you turn off the gas, working alongside CERT members? How do you make sure that your neighbors are okay, and things like that, communication drills within the families. And so every year, the Medical Reserve Corps practices their earthquake preparedness.
So let's shift to community resiliency. That's a very interesting topic in that you're building capacity within the community to actually stay healthy and keep healthy. Mm-hmm. How does that happen?
Well, our director of our program, Captain Rob Tisato, really was a early person on resiliency. He really brought that into the ethos of the Medical Reserve Corps. We really want to make the volunteers and the community members resilient against disasters, because accidents and natural disasters happen. The disaster happens after it, when people are not prepared and they're not ready for what is to come with, say, a 72-hour preparedness kit. So that has expanded to involve also physical fitness, activities, monitoring hypertension, all of the things that go into being resilient and healthy within yourself. And so we've been right there.
So what have you done in the last year that's been fun in the Medical Reserve Corps?
What have we done that's been fun in the last year as a Medical Reserve Corps? There's been some really interesting videos on YouTube.
Okay.
Yeah, we are incorporating technology into the things that we do on a regular basis, because we can't just bring out the same message all the time. Get a vaccination, get your flu shot, et cetera, et cetera. So local Medical Reserve Corps units have taken it upon themselves to create MRC-driven YouTube videos, encouraging people to get vaccinated, encouraging people to take their flu shots, and those have gone pretty viral, and they're pretty impressive.
That's great.
Yeah.
Now, let's shift. We've got a graphic on healthy people. So this is a kind of a national initiative. Can you tell us something about Healthy People 2020?
Well, Healthy People 2020 is a collaboration of what direction we need to go in the next 10 years to build resiliency and make people well and more physically fit. So I believe this is our third rendition of Healthy People, and it comes, it's developed with the assistance of cities and counties, and then the initiative is brought down to the cities and counties, and they implement it in their own way and fashion at the local level.
Let's dive into that. How do the local communities design Healthy People 2020 for their own community?
Well, the report comes out based on everyone's input, and these are the initiatives and the objectives under the certain titles as to what people can do. And so local, county, and city health departments will build their programs throughout the year to assist with healthy people.
So community leaders can say this is a priority for our community and work on their own action plans. Mm-hmm. If there is an MRC unit in that community, are they involved with that?
Yeah. A large majority of the Medical Reserve Corps across the nation, and especially here in California, are within the health departments to begin with. So they are right there for all of the meetings that take place for healthy people. And so the volunteers implement that on a regular basis, such as at health fairs.
So I'm reminded of Margaret Mead saying, you know, never doubt that a small group of people can change the world, because that's the only thing that ever has. So in a way, you're saying that if we want healthy communities, get involved.
Get involved.
And that you can actually affect something. Do you have an example of where people have got involved and actually done something within their local community that's helped to improve the health or improved resilience or got people ready for a disaster?
Well, down in Santa Barbara, they work alongside a local community event to assist with the homeless and walking through the community to make sure that everyone has the attention that they need. So they actually go to the people who are in need and have the health disparity, and they walk alongside and provide support for them and give them information about services that are available within the county. So the Medical Reserve Corps does that.
Well, bravo for Santa Barbara to pay attention. So they made the homeless a priority, and they coordinated programs to actually reach out. I think over here in Palo Alto, I remember my cousin was involved in a census of the homeless, and they went to all the creeks, and probably it was something like that. Now, is there a MRC unit in Palo Alto?
There is not an MRC unit in Palo Alto, but we are definitely looking to create one. Are you interested in creating a Medical Reserve Corps unit here in Palo Alto?
Oh, Jill, I thought you'd never ask. Actually, a group of us have got very interested in this. We've seen, almost, it's been a slow-running disaster in healthcare where people are concerned about medical bankruptcies and what can we do to improve things. And here in Silicon Valley, we just feel like we're the ones who are able to help move towards the future and innovate towards that. So what we'd like to do is start here in Palo Alto, the California Health Initiative, which might take a look at how we ourselves, not medical professionals, not in health, but just normal people in the community, can provide a sense of forward momentum so that we can improve our community's health. And so you've been guiding us in how to move forward. What do you normally do for a group of people like us trying to start a Medical Reserve Corps unit?
Well, the great thing about the Medical Reserve Corps is that we are not all health professionals. So I am not personally a health professional, and a lot of the volunteers are not health professionals. And so for a new coming up Medical Reserve Corps unit potential, I like to talk to you about, well, what kind of initiatives are you interested in doing, and what kinds of people are you going to bring to the table? So tell me a little bit about some of the people who are coming to the table for the California Health Initiative.
Okay. So we've got Dennett Lewis. He's an award-winning film producer in this studio. So he produces a fitness program called High Five. He really cares about fitness and nutrition. In fact, I think he brought these brownies to one of our meetings, and they were Paleolithic diet brownies. And it was making those brownies on the show that won him the award. So we've got people who are really, and Dennett works at Cisco, one of the high-tech companies. So you've got people in the high-tech companies who are also concerned about fitness and health and nutrition. So Dennett is co-chairing our FIT committee with Brian Shamp, who runs boot camps and is a leader in fitness programs in the Bay Area.
Have you done anything so far? Have you reached out to any communities so far?
Well, we actually heard that San Carlos was running a wellness district. And so we, district festival,
Sure.
and so we as the California Health Corps are thinking, how can we participate? So a group of us made a field trip to the School of Public Health at UC Berkeley, and you came with us. That was so great.
That was a good trip. That was a good trip.
And so Linda Newhouser there told us about participatory health. And so we're looking to see how we can use these ideas of participatory health, because we kind of get a sense that we want to participate and improve our health. And what we're finding is being part of the California Health Initiative, we're able to actually pay more attention to my health, our own health. And I say my health because I know that if I'm reaching out for that extra brownie, I'm just not going to eat it because I think Dennett might think I shouldn't have that. And it's very helpful. I'm actually losing weight as being part of the California Health Corps. But talking about going back to local community, we like to see how we can get this participatory design so that it becomes what we do within the California Health Initiative. Those of us who've been in the technology area know that customer experience really depends on people being engaged. And you don't engage people by telling them what to do or what's good for them. They just like you said with Healthy People 2020, you have to have people care about their future and want to design what they want. And once they're involved in that way, then we believe within the California Health Initiative, when we can engage people in designing the future they want, the health they want, the communities they want, then we can all work together to something that we care about, and that's really worth all our efforts.
Yeah. The limited resource is public health professionals, and that's why we need people to step up, such as yourself and others within your community, to volunteer to assist in this type of participatory design. This ability to say, well, this is what we need. We have identified this as a need. This is where our health disparity is. This is where our health illiteracy is within our community, and this is how we can help. Because really, when you just identify problems and have no solutions, then you're just overburdening the system versus coming up with a design and idea to assist.
Yeah, and I think there's several stages to that. So the problems can seem overwhelming. I think what we're saying is that, we want to tackle things that seem overwhelming at the beginning. One of the first things we did in forming the California Health Initiative was to take a field trip to the Asian Health Services in Oakland. They're so inspiring. They really care about their community. And it was shocking to us when they talked about treating the victims of human sex trafficking. So many issues because the victims couldn't report to the police because they couldn't keep going. It was just terrible. And just to see the care and concern and compassion of the doctors who were desperate to help their patients, it pulled to our hearts. And, many of us left thinking we have to do something. And so I think through something like the California Health Initiative, groups of concerned citizens can come together and start to tackle bigger problems like that over a period of time, not just try to throw money at the problem or say call 911. These are complicated problems, and I think the California Health Initiative, we're hoping to interest more people, especially young people, in working on these community disparities. Especially here in Silicon Valley, we have so much. We have so much opportunity. We've got the best people in the world coming here. We should be able to do more to help those around us. So that's kind of what we're trying to do. What advice do you have for us?
Well, for anybody interested in starting a Medical Reserve Corps, it's really about narrowing it down to what your mission is going to be. Because having lots of big ideas is fantastic, but you really need to be able to express yourself as to what your mission is going to be and how you're going to support your community and how you're going to be involved in your community. Because the California Health Initiative right now is a group of people trying to discover that. They're trying to discover what their path is going to be to get more integrated into the local community, to really identify the need and be able to find the assistance and recruit more volunteers for your California Health Initiative as your work groups grow. So throughout the state and throughout the nation, we try and support the new development of Medical Reserve Corps based on the experience of the Medical Reserve Corps that already exist. So really, we have a peer-to-peer network that is unlike any other. We really support the sharing of knowledge and the sharing of trainings throughout the nation and for all new Medical Reserve Corps units. And then you get to meet people like me.
We really look forward to connecting in this peer-to-peer network. One of our committees is called Learn. And in fact, we have a public health professional as part of that, and they're looking at how we can create modules that can spread the word more, but also be interactive and engage both people who are wanting to teach as well as people who want to learn. You asked earlier what our vision was. We actually have a vision. Perhaps we can see it on the monitor. A group of us came together. Our first meeting was actually under a tree in Fremont in the open air at a picnic table. So we were trying to be California healthy.
Right.
And we talked about what our vision might be. And then we developed it further. We went to offices in San Jose and spent a long time considering the vision, looking at it all from different places, and we came up with a completely a vision that captured our aspiration. And it's this vision which, can I have the graphic back again? To catalyze human potential to reimagine health. And the idea of reimagining health is that we see so much concentration on healthcare. You kind of wait till people get sick, but actually, we don't want to get sick. We want to imagine a world in which we do the things to keep resilient and healthy, and we only get sick when all of those things fail. So some of our committees are looking at this whole thing of how do we reboot health. In fact, we've got a reboot committee. And Cindy Mason will probably come on a future show and come and tell us about that. We're also looking at mental health, the relationship of the mind and the body to keeping people healthy. Because if you're not happy, you know, it's hard to stay healthy and feel energized about exercising or eating well. So I think the mental part of it is mental resilience is really important. Are there any MRC units doing things in mental health?
A lot of Medical Reserve Corps units have done some activities in mental health, but not necessarily in the way that you're thinking. So remember that a lot of the Medical Reserve Corps units in the past have worked on disaster issues. And so mental resiliency with psychological first aid and things like that. And so in LA, they went through and did a lot of psychological first aid here in the state of California. And so there are other trainers trained in psychological first aid here within the state and across the nation. And that's really been great to be able to support first responders and just be able to comfort them post-disaster or in the middle of the disaster. And so that's something that we've worked on in the past.
I think we talked earlier about how you're seeing a slight sort of shift in direction of the MRCs towards the emphasis on health. Could you say a little bit more about that?
Well, over the past couple of years, we have really taken the Surgeon General's priorities under our wings, and we've developed initiatives at the local level for the Medical Reserve Corps units to participate in of their own design. It's participatory design. Without knowing what that was, we've already been doing that. Yeah. So the Medical Reserve Corps units are given the opportunity to see the Surgeon General's priorities and initiate them. We also participated in promoting Let's Move over the past couple of years, Michelle Obama's initiative, and really developing that throughout the Medical Reserve Corps units if they were interested in participating in that. And so we are the in motion, in healthy food and eating. We really are trying to promote resiliency through a whole health point of view.
Gosh, one of our members is Eileen Serlin, and she wrote a whole series called Whole Person Healthcare. And so we are seeing how we can take that and put it through our learning platform and get that further out. So I hope that we can partner more on those kinds of initiatives and maybe cross-fertilize and get your guidance to do it in a way that is participatory. We feel that that's a very, very high priority for us. I'd like to show another graphic about the intentions of the founders of the California Health Corps. And we're inspired by this quote from Herophilus, who is the physician to Alexander the Great from 300 BC, and that without health, reason is powerless. If we do not have health, we can't do very much. And I think that is one of the strong motivations behind the California Health Initiative, that we take the best that we know and the best people that we have to find out how to engage with our local communities. We're particularly inspired by the Institute of Medicine over the last few years has been talking about the local community as a learning system for health. And that seems to have great potential for engaging people, because once we become a learning system as a local community, why stop at health? Why not go to thriving?
Yes,
and so we don't have to spend all the time thinking about disease and sickness, but how do we keep people healthy so that they're energized and happy and able to thrive in their own lives? Do you see this as something that might fit in with where the MRC units are going in the future, or do you think this is a direction that's kind of not in the mainstream?
Well, you have to remember that the local community designs
Yes.
their Medical Reserve Corps unit, and it catches on because it's peer-to-peer. And so what you find to be a fantastic idea, which I agree, this is where health is really moving. As you design this and start implementing it, and it can be replicated by other Medical Reserve Corps units, here you have a tree. You've just created the tree that you sat underneath when you were trying to come up with the vision, because we already have the roots. And so it's already a network for you to be able to disseminate your great ideas.
This is very exciting, and to know that while, people are looking at all the changes in healthcare, that there's the promise of health in the future, that people have been thinking seriously, building networks, setting up roots, the Healthy People 2020, that this has been an ongoing process for there's been 3 Healthy People.
Since I've been working on public health initiatives, there have been 3. That does not mean there weren't more prior to that, but yeah.
So this is a great opportunity for local people who are interested in improving their own health and the health of people in their communities to get involved. Mm-hmm. And so if they want to get involved, what do they do? Where should they go?
Well, if you'd like to get involved in a Medical Reserve Corps unit, you can go to the website medicalreservecorps.gov, and that has all of the information. Even if you're just an individual person and interested in volunteering, there is probably a Medical Reserve Corps unit near you, and you can just put in your home zip code, and it'll search right to your local Medical Reserve Corps and give you that point of contact. So once you've gone through the process of being recognized as a Medical Reserve Corps, your information will be there also. So when anybody puts in a Palo Alto zip code, they'll get right to you.
Thank you, Jill. This has been marvelous. I think it gives us hope for the future and health. Yeah. May we all be healthy. This has been a great show. Thank you for joining us today.
Thank you for inviting me. It's very nice.
Okay.
Thank you.
Bye.